Living a well-balanced lifestyle goes beyond ensuring your finances are in order. Welcome to Keeping the Well in Wealthy with Barbara Archer from Hightower. Barbara speaks with wellness industry leaders and related professionals to share more than financial planning advice. She addresses your questions about living a healthy lifestyle at any age. Learn how to gracefully maneuver life's challenges with support and resources to guide you along the way. Barbara and the team at Hightower help you make a plan, make an investment, and make a difference in your own wealth and well-being, and in your families, and within your community. Thank you for listening to Keeping the Well in Wealthy with Barbara Archer, sponsored by Hightower. Now, on to the show.
Hello, I'm Barbara Archer, your host for Keeping the Well and Wealthy, where we discuss living a healthy lifestyle and offering support and resources to gracefully maneuver life's challenges at any age. Today, we will be addressing diabetes, the differences in type 1 and type 2, what we can do to control some of the risk factors, how to identify the symptoms, and hear about updates to treatments and monitoring options. Did you realize that diabetes is the leading cause of new cases of blindness in working age adults, or that hearing loss is twice as common in people with diabetes compared to those without the disease? With prediabetes, the rate of hearing loss is 30% higher than those with normal blood glucose or blood sugar levels. And if you have diabetes, your chance of having a stroke doubles. An American Diabetes Association report found that the annual cost of the disease is nearly $413 billion. Medical costs for people living with diabetes have increased by 35% over the past decade. So another amazing statistic is that if people with diabetes participated in the workforce, like peers without the disease, there would be 2 million more people between the ages of 18 and 65 in the workforce. So now, please join me as we learn more from my guest, Dr. Kevin Peterson. Kevin is the Vice President of Primary Care and Quality at the American Diabetes Association, or ADA, and Professor Emeritus at the University of Minnesota Medical School. Prior to this position at the ADA, Dr. Peterson directed the Center of Excellence in Primary Care with additional appointments in the Institute for Health Informatics and the Institute for Engineering and Medicine. A fellow of the American Academy of Family Physicians and the Royal College of Surgeons of Edinburgh, Dr. Peterson has published hundreds of scientific articles and publications focusing on diabetes care, clinical trials, and medical engineering. So welcome, Kevin, and thank you for joining me today to educate my audience and me on diabetes.
Well, thank you very much, Barbara. It's really a pleasure to be here. I'm always happy to talk about diabetes.
Well, thank you for taking the time. And the first thing I'd like to know is how you became involved with the American Diabetes Association.
Well, I've been, interested in diabetes for a long, long time. I have to say that my first exposure to diabetes was way, way back in the 1960s when I had a cousin that came in and lived with us and had diabetes, and times were really tough at that time. Oh, I went on and my grandmother had developed diabetes. I thought, well, maybe I could help with this. But finally, when I got into my residency training, I started I started looking more closely. I asked for some time off to do some research in diabetes, and I got a grant and then got another one. And next thing you know, I was on the faculty, and it just went from there.
Oh my gosh. So you have always had a long history in this particular disease. So please explain the difference to me between type 1 and type 2 diabetes. We hear that, we see that, and what makes them so different from each other?
Well, in type 1 diabetes, the cells in the body that make insulin just don't work. The islets of Langerhans, that just don't work. There's no insulin that's produced. And so that usually occurs in young people, although we see it more in older people now, but it used to be called juvenile onset because people thought it only occurred in young people. The trouble with that is that when you lose insulin, that's a very serious condition, and it often resulted in death as in the years past before insulin. Type 2 diabetes is a disease that comes on where the insulin that's created doesn't work very well. It doesn't get the blood sugar into the cells very well, and that can come on oftentimes in later life. We used to call that maturity onset, but of course, now we see that occurring in younger people too. It's still a serious problem, and in the end, oftentimes those people will end up stopping making insulin, which again presents real serious problems, and the complications are serious, but it's a different presentation.
Well, my annual physical includes what's called an A1C test to check blood glucose levels. So, how accurate is this test? Why is it important? And my question is, can we eat or drink the night before anything we normally would before we have the test? And does that affect the results?
Well, you can relax about eating the night before because you're not really going to trick that old
Oh,
test.
good.
The A1C test is a great test that was invented not that long ago that measures the exposure of the hemoglobin to high blood sugars in the blood. And by doing that, we can get an estimate of your average blood sugar over the previous 90 days. So that test is going to be looking at how you've been doing overall for the last 3 months.
Hmm.
What you eat last night isn't going to make that much difference.
So
Is it
we should
accurate?
behave for 3 months. Is that what you're telling me?
Yeah, yeah. It means that
Okay.
that number is going to really looking at the last 3 months.
Okay.
It's a pretty accurate test. It's not perfect. It's not as accurate as some of our blood sugar measures that are accurate to the 1 point. Usually within half a point or so. But it's a good way to follow overall patterns in care. Are you better or worse than you were last time?
Oh, good. So, what are the symptoms of diabetes and how is it diagnosed?
Well, the classic symptoms of no insulin are an increased thirst, what we call, polydipsia, an increased desire to eat,
Mhm.
and then an increased amount of urination. Now, those symptoms have been recognized for actually thousands of years.
Oh,
But the
gosh.
the idea really is, I mean, the thing is, when a person has a risk for type 1, we have to be really careful and watch kids for this because when a child begins to have those kinds of symptoms, they ought to get checked right away. In older people, it doesn't always present that way. With type 2, it can present with a lot of different things, but a tiredness. I just don't have the energy I used to have. They might increased urination. They might notice increased urination. Maybe they'll just have a rash that they didn't used to have, or their eyes get blurred once in a while.
Hmm.
There are lots of ways that it can present as it comes on kind of insidiously in older people.
So, how is it finally diagnosed?
Well, there are a few different tests that we can run to diagnose diabetes, but all of them are based on a high blood sugar. When a blood sugar is elevated over a certain level, then that is the diagnosis of diabetes. That level depends on when you ate last and whether we've challenged you with a glucose challenge and things like that. So there are 3 or 4 different tests that we can use, but overall, high blood sugar.
High blood sugar. Now, is there a difference in type 1 or type 2 in its effects on children versus adults?
Well, the effects, the problems with diabetes the long-term problems are really caused by high blood sugar. And so those are the same in young people as they would be in old people. That is, a young person, if once they get a little bit of control, the problems because if you don't treat it at all, of course, with no insulin, that's deadly. But when you can treat it, the complications that we see developing are the result of long-term exposure to high blood sugar. So those are
Mm.
similar in older people as they are in younger people. The high blood sugar goes in and damages the very small blood vessels in the body. And so wherever in the body you have small blood vessels, that's the area that diabetes targets and damages.
So, like
And
toes,
yes, so
feet.
we see that.
Mhm.
So we see the little blood vessels that feed the nerves get blocked. Well, the longest nerves in the body have the biggest effect, and those are the ones that go to the toes and then the feet.
Mm.
And so people start losing sensation or they get tingling or burning in their feet. There's very small little blood vessels on the retina in the back of the eye. And so those get damaged and can result in a sudden bleed. And that is why diabetes is the leading cause of blindness in
Oh
America.
my gosh.
The other place is in the very little blood vessels in the kidneys where the kidney cleanses the blood. It takes the blood and cleans out that. And it does that by putting these blood vessels, or they putting the blood through very small filters. Well, it can block those blood vessels, which is why diabetes is also the leading cause of kidney failure in America.
Oh my goodness. Well, so with gestational diabetes, is that temporary? Is it much different than the other two types? And does it go away after the birth of a child? Because I hear of friends who have, or friends that I've had that have had gestational diabetes, and I've always wondered what what's their future prognosis?
Well, we classify gestational diabetes as a different kind of diabetes. It's one of the reasons I started getting involved when I first started
Hmm.
working with pregnant women and diabetes. The problems are different because now you have a baby you have to watch, and babies can be damaged as well by that really high blood sugar and all the problems that go along with it. Women develop gestational diabetes when they just aren't able to they don't have enough insulin to cope, and they and the trouble is that those babies can become like, with all the extra insulin or all the higher blood sugar, they don't get smaller, they get bigger. And so
Oh,
women can develop really big, unhealthy big children. About half of women that have gestational diabetes, it pretty much goes away afterwards. All women that had gestational diabetes should get screened again at about 6 weeks, because 50% of women that had gestational diabetes are at risk of developing diabetes later on in life.
oh my goodness. So now that we're talking about that and I'm learning more about what I'm surprised to hear that only half of it goes away. I always thought, well, it's when it's called gestational diabetes, after gestation, it must just disappear. And if that's not true, what are some of the other common misconceptions that we might hear about diabetes?
Oh my, so many misconceptions in diabetes, and a lot of them are due because are due from historical perceptions of what happened. I mean, one of the biggest is that eating causes that the what you eat causes diabetes. Well, that's not really true. I mean, obesity has a predisposition to diabetes, but people used to scold my grandmother when she was eating things that they didn't think she should eat. Well, we have to live a normal life, don't we?
Sure.
There are misconceptions. There are a lot of misconceptions around insulin. Some people are worried that insulin must be dangerous or cause other problems, when my goodness, nowadays insulin is such an easy to take pure replacement for a hormone that already exists in the blood. So I think there's some misconceptions about insulin as well.
Well, can you tell me a little bit about how insulin actually works in our bodies?
Yeah, insulin is a hormone that's secreted from the pancreas that promotes the delivery of glucose into the cells. So it helps glucose go into the cells. So mostly muscle cells, actually, but others as well. And so what happens when you don't have it around, or when it's not working, is that the blood sugar can't get into things like the muscle cells. And so people feel really tired because they don't have any energy and their blood sugars get really high. So it's kind of like those muscles are starving, but the sugar is all staying in the blood.
Oh, so how can a patient effectively manage blood sugar levels on a daily basis? And uh, I'm curious, if I have a friend that has diabetes, should I not offer them a piece of chocolate cake?
Well, I I think that the best management for diabetes is self-management. It's knowing more. The more you know about diabetes, the better you are able to take care of it. I would encourage everybody, that especially people that have diabetes, but people that have in the family of people with diabetes, I'd encourage them to learn more about how to manage. It's not an easy question when because suddenly we're kind of thinking like a pancreas. There are lots of different things that affect that, from activity to eating. It varies by weight and by age, and what we eat varies by our culture too. And the purpose of that education is for people to live a normal life. And everybody's life is a little different. So then the more we know about it, the better we're able to do that.
Well, what are some of the lifestyle changes you might suggest to a person with diabetes?
Well, we know that being sedentary and gaining a lot of weight, that's not good. So,
Mm.
a healthy lifestyle is the best lifestyle for diabetes. You mentioned, how should a person restrict what they have? Well, we want a person to be able to live a healthy life, and that means eat healthy foods. It's probably not good for anybody to eat a whole bunch of unhealthy foods, including lots of chocolate cake. But
Yes.
every once in a while, yeah, that's fine. I think that I would encourage in a healthy lifestyle. You know what that really means, and we're all going to groan. It means exercise. It means out activity, walking. You don't have to be a marathon runner. Get out and walk to the mailbox, or get out and walk to the store. It means moderation in what you're eating. Try to keep a fit. Try not to gain those extra few pounds. It'll do you better in the long run.
So, what can make a person more susceptible to having diabetes in the first place?
Well, a lot of this is your genetic predisposition. I'm afraid that a lot of
Okay.
people don't have a lot of choice.
Mm.
Some of it is passed down. Actually, type 2 diabetes is passed down more in families than type 1. But
Really? Type 2?
yeah, it is. People sometimes think people with type 1 must have it in the family, and children with type 1 have a 14% higher rate than if they have a brother or sister. But type 2, boy, if you have it running in your family, you can have a 50% chance of developing later on in life. So it's passed down by that. It's not just that people have misbehaved, another misconception. If and then part of it's going to be, again, maintaining that healthy lifestyle.
Okay. So, weight is an important factor as well, besides the foods we eat and the exercise.
No doubt
So,
about it. Gaining fat itself is very insulin resistant. It just needs lots of insulin, and it doesn't respond very well. And so the more fat you have, the more you're straining your pancreas, and it just can't keep up after a while.
can you reverse type? Well, if it's weight related type 2 diabetes, is that reversible?
Well, I wish we had agreement on that. A lot of people talk about remission. I think that you can, if you get control of your lifestyle, and you get more healthy, you drop weight. Some people do that through surgery or through medicines. They can drop weight. They find that they don't need to be treated for diabetes anymore. So we call that a remission. I wouldn't say it never like goes away. If you gained your weight back, it probably come back.
Excuse the interruption. I know you're listening to Hightower's Keeping the Well and Wealthy podcast, but if you have questions related to these or other wellness and financial issues, please reach out to your advisor or go to hightoweradvisors.com to find a financial advisor near you. Now, back to Barbara.
Oh, that's interesting. So, what are some of the additional physical side effects from diabetes? We've talked about a little bit the toes because of the lack of circulation. So, other foot issues or other things that, I mean, I'm surprised I didn't even think about the small blood vessels behind the eye and that being the reason for blindness.
Sure. There are the major complications or problems with diabetes is that are usually related to those small blood vessels. And so we mentioned those being the nerve damage or nerve. People begin to lose the sensation in their feet, and then that can lead to trauma or an accidental injury. I'd encourage people that if they begin to lose the sensation of the feet, they should really be looking. The first thing you can do is get shoes that fit, orthotic
Yes.
shoes. Get stuff that, put away those heels and get into some shoes that don't cause damage because you won't feel it.
When people say they have neuropathy, is that maybe an inkling that they should get their blood sugar checked as well?
Yeah, it really is related.
Mm.
The neuropathy is, all of these things are the result of a long-term exposure to high blood sugar. So neuropathy is the complication due to the high blood sugar for too long, as is the kidney disease and as is other complications like eye disease. Everybody should get screened too, by the way, get their eyes looked at once a year with diabetes, because you want to see in the back of those blood vessels. Sometimes people think, well, my eyes will start getting worse slowly and then I'll go in and be seen, but that's not the way it works. Your eyes are fine, everything seems fine, and then boom, the little blood vessels, they get blocked, and so they create other little blood vessels to get around it, and then one day, boom, one bleeds. Oh, that's one eye gone. So it comes down really suddenly. If you get them checked, gosh, there's really good medicine and good treatments to help prevent those things from bleeding and keeping eyesight.
So get ahead of it, right?
Get ahead of it. All of this stuff is prevention is worth a pound of cure.
That's for many of our diseases, isn't it? Just prevention if we can.
It is so.
Whatever genetics doesn't curse us with sometimes. But what are the latest advancements in diabetes treatments? What's new? What's out there? Fill us in.
There's really wonderful stuff. I'm going to divide it into type 1 and type 2. So in type 1, we've got some amazing, well, of course, we've just not long, it hasn't been long that we've had what's called the hybrid closed loop system. It's a system that measures your blood sugar and then delivers the insulin directly to you. Now, it's not exactly the same as an artificial pancreas, because the pancreas works directly with the blood, and these systems work with the subcutaneous tissue. So that's not quite the same. It's a little slower to respond, but it's wonderful stuff. And our kids are so much better with it. We have our ADA camps. I just love it because they follow these kids. They were following 300 kids all in the same computer board, and they used to have 35 kids a day with low blood sugars. Now that they had one episode.
Oh my
it was
gosh.
great.
That's amazing.
These systems are great. Now, that's not the end of it, because we've now actually begun to take a look at creating those islet cells and implanting them and have them create insulin themselves. Still experimental, but
there's
really
hope.
promising. Really promising. Really promising.
That's so exciting.
I think for the first time at the American Diabetes Association sessions last year, I heard our chief medical officer talk about a possible cure. So I think that's wonderful stuff. With type 2, by the way, there's lots of advances as well. We've got, of course, everybody hears about all the Ozempic stuff and how that's great for weight loss, but it's actually a diabetes medicine, and it's wonderful because it allows people just to kind of turn off that drive to eat, and the loss of weight does great things for their diabetes. Sometimes they go right into remission without needing additional work. In the long run, that's going to help complications a lot. So, and we have lots of those medicines coming out. We have lots of companies working on it. So Ozempic is first generation. We've got Mounjaro, second generation, and we've got new ones that are kind of that third generation, affecting 3 different incretin sites, 3 different sites in the body. These are wonderful things, major advances.
That's so exciting. So it's not, when I grew up, my girlfriend that had diabetes, I felt like she was always sticking her finger, and then she would show me how she would shoot the insulin into her stomach or her thigh, and I'd be like, okay. I mean, it seemed just ongoing and ongoing.
It has been historically too. It's been a real trial. When I was young, I'd watch my cousin boil the needle in the morning and take 1 shot a day, using this great big needle he'd hand sharpened.
Oh my gosh.
Nowadays, these, with the hybrid closed loop systems, you pop them on, and they're great.
How long do they last when they put them on?
Well, they can last 2 or 3 days. They
Gosh.
do have to get changed, but it's not, we don't even really need to do very much finger pricking, not like we used to. People should still know how to do that.
Sure.
At the camp I was at, one of the comments from one of the workers was that she needed to go find an insulin syringe and she couldn't find it, and she just thought it was amazing that she was at diabetes camp and she had to be looking for an insulin syringe.
Oh my gosh.
Yeah,
There
it's wonderful
has
stuff.
been such great progress, and I'm excited to hear about the future too. That's really terrific news. So, people that do suffer from diabetes, though, how does that maybe affect their mental health? Is there any more depression or anxiety or stress? You mentioned fatigue, so that I know can be one of the symptoms, but just from a mental health standpoint, is
Well,
there any different challenge?
I'm gonna turn it around a little bit and say, the the problem with one of the problems with mental health, which is such a problem in our society, is that it's really hard to cope with diabetes when your mental health is not where it should be. So I think what we found is that, gosh, when people come in with depression or problems with just coping with their life, we have to fix that. Has to be addressed first. Otherwise, you'll never get around to getting control of your diabetes. It takes work to do that. You need to be fit mentally. So
Sure.
mental health kind of in the medical world kind of trumps. You have to get that taken care of, then get on with the diabetes.
Well, thank you for that. Now, are there any sexual implications from the disease? And if so, if there are any treatments available?
I'm really glad you mentioned it because it's kind of one of those things people don't, they're kind of shy about talking about. They don't want to say something about it, but
Yeah, well, I
it's,
guess you figured out I'm not shy, right, Kevin?
well, I'm glad you can ask. Yes, it is a common cause. It is particularly common cause of erectile dysfunction. As people get older, erectile dysfunction is a pretty common thing among men, and it's even more common among people with diabetes. And yet it can. People should talk about it with a doctor because there are things available. There are ways to, we have a variety of different medicines that can help with that. We have a variety of other supports that can be used. So, yes, it's a common problem, both in men and in women, that needs to be talked more thoroughly with your primary care doctor and encourage people to talk about it.
All right, anyone out there with diabetes, please talk to your doctor. Don't ignore that. So, you mentioned about exercise helping. Is there a specific kind of regimen? I mean, strength training or aerobics better? Is there one, or are there specific precautions that people with diabetes should take when they begin an exercise program?
Well, if you have diabetes, I'd encourage you to talk to your doctor before you start a vigorous program, because especially if you're a little ways down the line and some of those blood vessels getting pretty tender and fragile, I don't really want people standing on their head, putting pressure on those blood vessels on the eye, or
Oh,
or
good.
or running around if they don't have their foot sensation quite up to scratch, because
Sure.
running can cause trouble as well. So I'd always encourage a person to check with their doctor. Also, heart disease is very common, and by golly, we ought to get your clearance from your doctor before you start a program, partly just to keep your heart safe. So yeah, I'd encourage people to. But then the kind of exercise that a person can do, well, if you aren't affected by any of those problems, then I'm going to say there's not very much that you should be limited to. And so we have Olympic athletes that are on that have had diabetes all their life, and they do a wonderful job and are enormously competitive.
That's a
I think,
really good point. You're right.
yeah.
Yes, the Olympic
So
athletes with diabetes. Okay.
they do great. They have to watch a little bit, but they do great. I'm a big fan of walking, probably even a bigger fan of walking than I am of running, because I do see quite a few, those knees and those hips.
Yep.
They can wear
Injuries.
out. Injuries
Hmm.
can come along. But walking is great. Activity is great. We just spent too much time sitting in the car
Or in front of our computers
or in front of a TV.
or a TV. Okay. Well, Everyone listen up. Go take a walk after dinner. Don't turn on the TV. Go take a walk.
Isn't it expected that you get a doctor on here and he tells you to live a healthy lifestyle?
Oh,
But it
gosh.
really is important.
So, speaking of healthy lifestyle, I'm surprised to hear that type 2 diabetes can have some genetic predisposition. So, are there steps we can all take, though, just to reduce the risk of developing type 2 diabetes?
Well, I think that the major cautions are going to be things like keeping your weight under control,
Okay,
keeping a
wait.
physically active, keeping yourself physically active. In the studies that have been done, things like going on a diet will allow a person to lose weight, but most people can't control that. Most people gain their weight back, and only about 30% of people can maintain a diet for over 3 years. When we look at
30%. Wow.
30%,
So, there
not,
goes
yeah.
those resolutions sometimes, huh? So,
With exercise, though, we were able to see that 70% of people could maintain an exercise regimen for 10 years. That's great.
oh,
So, on the whole, watch what you eat and get out there and get active.
all right, get active. So, what are your hopes, Kevin, for the future in terms of diabetes treatment and management? And how do you envision the landscape of diabetes care evolving?
Well, I'm hopeful. I think that we're going to have a cure for type 1 diabetes.
Mm. That would be
Hopefully
such a blessing.
soon, I think in my lifetime. And I'm an older guy.
Well, that's
I
very hopeful. I love hearing this.
certainly in the lifetime of many people that are younger. I think that we're going to see some dramatic changes in the care of type 2. Oh, we're going to have other challenges. If we get a medicine that helps people lose lots of weight, that's great. But how are we going to keep them healthy? Because
Ah,
the current medicines take away your muscle as well as your fat. So
oh, good point.
yeah, we lose muscle as well
Yes.
as fat. And then, of course, nobody wants to lose 50% of their muscle. They just want to lose 50% of their fat.
Oh my
So,
gosh.
so we have to, when we get on these medicines, we have to, exercise and activity becomes even more important. And what kind? Walking, lifting. I like lifting. I think that's great. Isometrics, dance, goodness sakes, yoga. I think whatever makes you feel good and keeps you in
It
good
keeps you
shape.
moving, right?
Yep, keeps you moving.
Well, can you recommend some resources or support groups that have been helpful to patients with diabetes?
Yeah, well, I, of course, think that the American Diabetes Association is the premier organization in our country for providing support for people with diabetes. So I would encourage people to visit the American Diabetes Association website. There is wonderful educational information. We provide the training for more diabetes educators than anyone else in the world.
And that's
Uh,
simply diabetes.org, correct?
diabetes.org.
Okay, simple.
The Center for Disease Control and Prevention also has some wonderful sites that provide information for people with diabetes. And oftentimes, all of these organizations are providing this in multiple languages. So I would also recommend their site.
Well, thank you. I will get those on our podcast notes. So, Kevin, you've been so informative on sharing your knowledge in diabetes. And some of the notes I've picked up here are that common symptoms can be urinating often, feeling very thirsty, extreme fatigue, and even possibly blurry vision. Early detection can reduce diabetes complications like cardiovascular disease, neuropathy, eye related diseases, gum disease, and medications have changed. And not all people with diabetes need insulin injections every day that I'm used to hearing about. So, Kevin, my final question for you is this: how do you keep your well and wealthy?
Oh gosh, I think that there's nothing that's worth more than being healthy. And so I'm try to live the life. I'm out in the gym 3 to 4 times a week. My trainer is a real support for me and provides that information. It provides actually he trains me and my whole family. I think that activity and healthy living and a healthy lifestyle and eating properly. Gosh, that's the way we maintain our health. And what is wealth if we don't have health?
Well, thank you for that. I really appreciate you joining me today, Kevin, for educating us on diabetes and our challenges today. Please look for the podcast notes to find more information on the American Diabetes Association at diabetes.org, and look for the ADA's Ask the Experts podcast to learn more. So thank you for tuning in and listening to Keeping the Well and Wealthy with me as your host, Barbara Archer. If you have not yet subscribed to the podcast, please click the subscribe now button below. This way, when I come out with a new podcast, it will show up directly on your listening device. And we humbly ask you to share this podcast, rate it, and leave a review, as this actually helps others find the show. Again, thanks for listening today. From everyone at Hightower Advisors, this is Barbara Archer reminding you to go out in the world and make a difference. We'll see you next time. Bye.
Thank you for listening to Keeping the Well in Wealthy with Barbara Archer, sponsored by Hightower. Click the follow button to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guest and does not necessarily represent the views or opinions of Hightower Wealth Advisors. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning.
Hightower Wealth Advisors is a group comprised of investment professionals registered with Hightower Advisors, LLC, an SEC registered investment advisor. Some investment professionals may also be registered with Hightower Securities, LLC, member FINRA and SIPC. Advisory services are offered through Hightower Advisors, LLC. Securities are offered through Hightower Securities, LLC. This is not an offer to buy or sell securities. No investment process is free of risk, and there is no guarantee that the investment process or the investment opportunities referenced herein will be profitable. Past performance is neither indicative nor a guarantee of future results. The investment opportunities referenced herein may not be suitable for all investors. All data or other information referenced herein is from sources believed to be reliable. Any opinions, news, research, analysis, prices, or other data or information contained in this presentation is provided as general market commentary and does not constitute investment advice. Hightower Wealth Advisors and Hightower Advisors LLC or any of its affiliates make no representations or warranties expressed or implied as to the accuracy or completeness of the information or for statements or errors or omissions or results obtained from the use of this information. Hightower Wealth Advisors and Hightower Advisors LLC assume no liability for any action made or taken in reliance on or relating in any way to this information. The information is provided as of the date referenced in the document. Such data and other information are subject to change without notice. This document was created for informational purposes only. The opinions expressed herein are solely those of the authors and do not represent those of Hightower Advisors LLC or any of its affiliates. Hightower Advisors LLC or any of its affiliates do not provide tax or legal advice. This material is not intended or written to provide and should not be relied upon or used as a substitute for tax or legal advice. Information contained herein does not consider an individual's or entity's specific circumstances or applicable governing law, which may vary from jurisdiction to jurisdiction and be subject to change. Clients are urged to consult their tax or legal advisor for related questions.